How is healing inside your mouth different than healing outside your mouth? If you were to fall and scrape your knee, which all of us have done, what happens? Well, we've got broken skin. Our blood system comes into play and we have a clot formed. There is a fibrin clot. There are platelets that come to the area. All of this heals the area, prevents infection, but then also the skin grows over the top. Many of us are familiar with a scab, which is kind of this fibrin clot that's hardened. It's kind of a brownish layer that forms before the skin underneath forms. That is not how things inside your mouth heal. So if you were to have oral surgery or lose a baby tooth, how does that heal and how is that different? Well, the skin inside of our mouth is called mucosa. It's got a little bit different characteristics than the skin on the outside. Obviously, inside our mouth is also wet. Also inside of our mouth, we have a ton of bacteria. The good news is that because we have such a good blood supply in our mouth, things heal up pretty well and we don't see a lot of infections per se when you have a baby tooth come out. Something very similar happens. A fibrinous clot forms inside of our mouth that forms more of kind of a white layer. Sometimes people mistake that for being an infection, but that is how it forms. We don't get a scab inside of our mouth. The other thing about the stuff inside of our mouth is that it's much more stretchy and things do tend to heal up pretty fast. But a very similar process happens inside of our mouth without the scab, and we have a lot more blood supply, which means white blood cells and platelets and things like that heal faster inside of our mouth than they would on our skin. It also means we're less likely to get an infection because there are more white blood cells to fight that infection that happens inside of our mouth.